Sildenafil side effects. How common are they? Sildenafil has been used as an erectile dysfunction treatment for over 20 years and is clinically proven to be safe and effective for most men. Like any medication though, sildenafil can sometimes cause side effects. Not everybody gets them, and most of the side effects reported with sildenafil are fairly mild and don't last long. The most common side effect of sildenafil is headache, affecting about 25% of people who are prescribed it. The good news is that treating headaches as a result of taking sildenafil can often simply be a case of altering the dose that you are taking. A study from 2000 showed that there was a significant difference between the likelihood of experiencing side effects in higher doses compared to lower doses. At Newman, we prescribe 25 mg, 50 mg, and 100 mg of sildenafil. If you're on 100 mg or 50 mg and feel you would benefit from lowering your dose, don't hesitate to reach out to our clinical team who can advise you on how best to proceed. Other potential common side effects, which may affect up to 1 in 10 people, include stuffy nose, nausea, facial flushing, suddenly feeling hot, blurred or color-tinged vision, dizziness, indigestion. If you are prescribed sildenafil tablets, a full list of sildenafil side effects will be provided in the Patient Information Leaflet, PIL, that comes with your medication. You should read this before taking sildenafil for the first time to help you take it safely. Sildenafil tablets should not be taken if you are allergic to sildenafil or any of the other ingredients used to make them. A list of these ingredients is also included in the pill. Sildenafil versus tadalafil, which has a lower chance of side effects. A recent large-scale analysis of 16 different clinical trials showed that sildenafil and tadalafil have similar efficacy and safety profiles, meaning they are just about as safe and effective as each other. If you're weighing your options up and don't know which of these ED treatments to choose, you can rest assured knowing that they are both safe for most men to take. Can I take sildenafil with other medications? There are some medications that can interact with sildenafil if you take them both at the same time. It's important to talk to a clinician before taking sildenafil to make sure that it's safe for you to take and won't interact with any medications you're taking. You should not take sildenafil if you are taking medicines called nitrates, which are often given for relief of angina pectoris or chest pain. Combining these may lead to a dangerous fall in blood pressure. Using any of the medicines known as nitric oxide donors such as amyl nitrite poppers. Taking these at the same time as sildenafil may also lead to a dangerous fall in blood pressure. Taking riociguat. Is there anything else to know before taking sildenafil? As with any medicine, it's always best to read the Patient Information Leaflet, PIL, that comes with your sildenafil tablets before taking them. We at Newman also provide a link to a safety information page for easy reference, so you can check important safety information with greater convenience. Certain conditions can make it unsafe to take sildenafil. You should not take sildenafil if you have a severe heart or liver problem, recently had a stroke or a heart attack, or if you have low blood pressure. Certain rare inherited eye diseases such as retinitis pigmentosa, ever had loss of vision due to non-arteritic anterior ischemic optic neuropathy, NAION. If you have or have ever had any of these conditions, PDE5 inhibitors such as sildenafil are unlikely to be suitable for you. If this is the case, other erectile dysfunction treatments may prove to be more appropriate. This is not an exhaustive list of conditions that make sildenafil unsafe to take. It's highly recommended that you consult a clinician before taking sildenafil tablets so that, if they're safe for you to take. The Newman Take Sildenafil is a generally safe and effective treatment for erectile dysfunction. Like most medicines, it may cause side effects in some people. However, not everyone gets them. Many clinical trials spanning over 20 years have found it to be safe for most men to take. Common sildenafil side effects are headache, indigestion, a stuffy nose, facial flushing, suddenly feeling hot, blurred or color-tinged vision, nausea and dizziness. If you do happen to experience these side effects, they should only be mild and shouldn't last long after you stop taking sildenafil. Always talk to a clinician before taking sildenafil to ensure it's safe for you to take and won't interact with any medication you're taking. If you are prescribed sildenafil tablets, read the patient information leaflet provided with it thoroughly before taking the medication.